All right, excited to have Dr. Clay Moss here as part of our Science Corner. Dr. Clay Moss is a licensed medical doctor completing formal training in physical medicine and rehabilitation. His focus on longevity and human performance treats the body as an integrated system with an emphasis on metabolic health, strength, and prevention. Drawing from both conventional and functional medicine, Dr. Moss translates complex topics like hormones, inflammation, gut health, and recovery into clear steps people can use in everyday life. His work centers on helping people build strength, protect their brain, metabolism, and prevent disease before it starts. Dr. Moss, thank you so much for joining us today.
Yeah, Jordan, thank you for having me. Good to see you again.
Awesome. So, Dr. Moss, you've talked a lot about how medicine often treats symptoms rather than root causes. Was there a specific experience in your training and or clinical work that really shifted how you think about health and disease?
There's a couple in my clinical work, but I think it all kind of started back when I was in college. Like I had a similar situation to a lot of people. I was chronically sick and not really getting any sort of relief from it. And I was diagnosed with strep throat 4 to 6 times a year for 4 straight years while I was in college and a little bit before. Kept going to an urgent care, not really getting the same follow-up from the same person. Nobody's really looking into the root cause. And so I would just get an antibiotic, get a steroid shot, and be sent on my way, and then I'd be back in 1 month. And so that was kind of this continuous cycle where I was just miserable all the time. Like I was still working out. I looked good. I looked aesthetically good. So in my mind, I'm thinking like, there's nothing I can do. I mean, I look good on the outside. I should feel good on the inside, but I'm not. So this is just all happening to me, and I have no sense of control over it, and no doctors telling me otherwise. So, what do I know? And it kind of cultivated a little bit of resentment to the medical community a little bit for me. And I was already going into medicine at that point. So, after so much, I was convinced to take my tonsils out. I got my tonsils out right before I went to medical school. I ended up getting strep throat 6 weeks after I got my tonsils out, which I was told was impossible. And so I went into medical school with kind of this weird sense of, okay, what are we missing here? Like, obviously what we're doing in medicine is not working. It's not treating the patient. And I have heard so many other examples that of other people's stories that are considerably worse than mine. And so when I got into med school, originally I had convinced myself all throughout childhood that I was going to be a surgeon. I got into medical school. I started learning about the body, and COVID hit, kind of gave me a little bit of a renewed sense of, what is this all about? And when I went into my clinical work, I realized I didn't really love being in an OR that much. I actually want to talk to people and focus on how they can make the best versions of themselves. I grew up around the Andrews Institute, so I was constantly exposed to all of these high-performing athletes as well. So I always had this kind of instilled sense of how do we maximize human performance, whether it's a high-performance athlete or just your day-to-day person or somebody that's just trying to get 1% better each day. So that led me to go into the field of PM&R, physical medicine and rehabilitation. There's all these words. It's probably why nobody knows what it is, which mainly focuses on just that, trying to take somebody from where they are right now, whether that's after a traumatic brain injury, stroke, spinal cord injury, or whether they've just been injured by sports, or whether they're just at baseline and they want to get better, and just take them to that next step and see how far we can get them along so that they can perform their activities of daily living as best as they can, perform at the highest level that they best can if they want to compete in some way. And so I've always kind of had this performance mindset where it doesn't matter what stage you're at, how can we get you to that next step? And that was what led me to this field called functional medicine, which kind of encompasses all of that. Did I answer your question? I know I'm kind of ranting here.
No, that's great. So you mentioned functional medicine, and we hear that term thrown around a lot. For people that may hear this term but may not know much about it, how would you define functional medicine in practical terms?
Yeah, well, I'll take a step back actually to your previous question first, because in my clinical life, I continuously see patients that come in on 15 different medications, and each one is treating a symptom likely that the last medication caused, all starting from one medication of they come in and they have high blood pressure, and here you go, we'll put you on a high blood pressure medication, not really talking about the root cause of the problem. And what functional medicine is in plain words, just asking why a few more times. And, we use all the tools that conventional medicine use, plus lifestyle, environmental factors, and really hone in on metabolism and metabolic dysfunction. And so instead of saying, you're tired, here's a stimulant, we're saying, are you insulin resistant? Is your sleep broken? Are your hormones low for your age? Are you inflamed? Are you nutrient deficient? Is your nervous system stuck in fight or flight mode? What's your cortisol rhythm like? There's so many other questions that need to be asked. And I think when you're in a traditional healthcare system, so much of it is garnered by what insurance allows the doctor to ask and the doctor to test and the doctor to treat. And B, because of that system, doctors don't have enough time to really do that. And so, for better or for worse, you kind of almost have to step away from the traditional healthcare system a little bit in order to start asking those questions, get quality time with your patients, and actually diagnose things from a root cause so that you're not just putting people on medications immediately.
Got it. No, that's super interesting. So I like that, just asking a few more questions. I think that's a really good way of defining what I think is like buzzwords that get thrown around a lot. So I think that's great.
Yeah.
So you and I are fortunate enough to be talking during Movember, which has now become a time that's focused on men's health awareness. And you shared a lot of your personal stories around your own health journeys that led you to where you are today. And so in your experience, what are some of the biggest blind spots that men have when it comes to their own health?
Yeah, I think probably the biggest one is that us as men tend to equate "I feel fine" with "I am fine."
Guilty as charged.
Right. Yeah. I mean, a lot of men feel okay right up until their first big event when they're 55 years old and they're having a heart attack and they haven't been taking care of themselves up until that point. But they're able to get through their day-to-day life. They're able to go to work. They don't really need to work out and they feel somewhat okay. Right. So like things like atherosclerosis, insulin resistance, low-grade inflammation, low testosterone, those are often silent for years. And I think us just we're innately want to think that we're doing okay when we really just are scared to kind of check under the hood. And so that's a big one. Another one is ignoring the basics because they're boring. So like things like sleep, strength training, protein intake, stress, alcohol consumption. Most of us, especially as men, we want a supplement stack, but are sleeping 5 hours and drinking every weekend. So we kind of want that quick fix. And I don't think that's just for men. I think that's everybody. We want that sexy quick fix pill that's going to make everything better, when in reality it actually is hard work and dedication that really is going to carry you throughout the rest of your life and enjoy those golden years towards the last 15, 20, 30 years.
I can appreciate you saying that. I actually just had a conversation recently where I said no amount of magnesium is going to fix the fact that we binge Netflix until 3 a.m. And so I think that I think that holds true here, and I think that's a very validating way that you just described that too.
Yeah.
And so if we men, we ignore these issues. I can guarantee that I'm guilty of this as well. If you could redesign the typical annual physical specifically for men's health, what would you add or emphasize that maybe most physicians overlook or don't really focus on?
Well, I guess first off, we need to do a better job at actually getting men to the doctor, especially younger men. I think a lot of times we delay things like getting lab draws. We avoid primary care. We often wait until there's a crisis, like I said before. So I'm not sure what the fix is there, but we need to do a much better job of creating an environment that's inviting for men. It doesn't feel like, oh, there's something wrong with me, so I'm going to the doctor. Like it almost needs to feel like a social club or like a health club or like going to the gym, where you feel rewarded of going to the doctor. Instead of them saying, here's what's wrong with you, here's a pill, let's say, here's the things we need to work on. This is exciting because if you feel okay now, you're going to feel considerably better when we actually get you to a good place. And so that's number one. As far as the annual physical, like I said before, the main thing is time. I mean, the last time I went to my annual physical with my primary care doctor, I saw him for 4 to 6 minutes, maybe. I don't think he really even laid a hand on me. Maybe he checked my heart, like they check a blood pressure before I come in. Half the time that's inaccurate, because you had just gotten there. They bring you back, they sit you down. You're not really sitting for very long. They're not taking it on elevated surface. So many parts about that are inaccurate, and we're treating based on those. But then, I'd keep the stethoscope and the blood pressure, but I'd upgrade what we call like the software. So for most men, as far as labs go on your general physical exam visit, I would get better metabolic testing. So I want to get everybody's fasting insulin, because that tends to show up years before you see those other diabetic labs like a hemoglobin A1C start to get out of whack. I'd want to get an ApoB instead of your typical LDL cholesterol panel, so that you have a better idea of what your cardiovascular risk is. I'd want to get vitamin testing and see where you're at with your vitamin D levels, your magnesium levels, these things that we know are super vital to just vitality in general, to just living everyday life. I want to get a hormone snapshot, obviously. Total free testosterone, sex hormone binding globulin, thyroid panel, all of these things that we kind of overlook until somebody says these really key buzzwords in that 4 to 6 minute visit, which probably aren't going to happen because you only have so many things to say. But the main things, as far as the physical goes, I'd want to really emphasize body composition and fitness, not just weight. So we tend to get really honed in on BMI, body mass index. And we've found that that's just not a great, it's a good way of determining total population health, because we're not a very healthy population. And so BMI tends to kind of sway towards, are you obese? Are you not obese? But if you get somebody that's, extremely muscular and they're also running a good bit, they have great cardiovascular fitness and a VO2 max, and you do a BMI test and they say they're morbidly obese, that just sways the results. So I'd want to get people in, take a baseline waist circumference and track that over time. Visceral fat risk. So doing something like a DEXA scan, which I think needs to be much more widely available. It's not a very expensive test. It maybe costs $100 in some places, but it gives you a very clear image of how much muscle mass do you have. And that's huge for things like insulin resistance. How much body fat do you have? What's the ratio of those two, and where do we need to kind of target our interventions based off that? Another thing would be, probably the biggest thing would be fitness tests. So like your grip strength, which is just a vector for determining your overall strength. And there's been so many studies on kind of relating grip strength to all-cause mortality. And also your VO2 max. I think your VO2 max, which is basically your body's ability to convert oxygen into a usable form and produce energy, is maybe the number one way that we can determine what's your percent likelihood of dying within the next 20 years. So the fact that we don't address those on any of our visits, unless you get super specialized into being referred different places, is mind-blowing to me, because those should be the first things that you get when you walk in the door.
Got it. Awesome. Super comprehensive. And I think that's a great list for people to kind of think through and be able to prioritize when they're going in to talk to their doctors or decide how they want to handle their own health patterns moving forward.
Yeah.
So I want to get a little more targeted on some specific issues related to men's health. So, we talk about prostate health, we talk about testicular health. Right. Let's start with the prostate. Prostate cancer screening has evolved a lot in the past decade. Right. So how do you currently think about like PSA testing, and when should men really start paying attention to this?
Earlier than I would say they need to start considering this earlier than we're recommending them on a nationwide scale to start paying attention to it. So first thing, prostate cancer is one of the very few cancers where most deaths are very preventable if we screen thoughtfully and early enough. So the current guidelines, I think, say that you need to screen ages 55 to 69, stop at 70. But like, for instance, in the recent case of former President Biden, had metastatic high-grade prostate cancer well into his 80s, despite elite medical access. And that's a pretty brutal example of how the medical system can fail. So he reportedly didn't have a PSA checked, which is our typical screening method for, monitoring prostate levels, since his early 70s. So it had been over 10 years. And that exact kind of gap allows a slow, very preventable cancer to become life-threatening and metastatic. So, for basically painting broad strokes, I would start earlier for most men. So like a baseline PSA level, probably in the early to mid 40s. I've had mine checked now just because I get comprehensive blood work, and that later in life will at least let me gauge a trend. Because I think the problem with what modern medicine does is that we take a PSA on almost a snapshot whenever you're 50 years old, and we say, oh, it's over 4. We need to start slamming you with drugs. We need to start, we need to start getting you MRIs. We need to do a biopsy, all these kind of highly interventional things. And we didn't know what it was like when they were 5 years younger. right? So, if it had been at 4 since they were 20 years old, that's a little bit different than if it was at 1 a year prior and 4 that year. So you need to look at the dynamics, not just the single number, and see how fast is it rising from year to year. There's also a thing called PSA density that I know a lot of physicians are starting to use. I haven't personally used it myself, but I know it's becoming more widely used, where basically it's the PSA, which is what you take in a lab value, divided by the prostate volume, and that kind of gives you a little bit better of an idea. And then there's also a free PSA level. So basically it's unbound by protein in the blood. And what's interesting about that is that you actually want a higher percent of free PSA, because benign prostate tissue tends to create free PSA, whereas cancerous prostate tissue tends to create bound PSA by different sort of, they're immature PSA molecules, so they get bound by things in the blood. And so when you see like a really low free PSA percentage, that kind of triggers a little bit of like, okay, we need to take a bigger look here. Sorry, my camera was flashing for a little bit. You can still see me, right?
Yeah, you're good.
Okay, cool. It was flashing at me and I was like, uh-oh. But yeah, and the last thing is, don't automatically stop at 70. We have people that are living considerably longer than 70 and living well into their 80s, especially if we, do all these lifestyle interventions like we're talking about. And I think we're doing a massive disservice to stopping when a man is 70, because you never know. They could get prostate cancer at 75. It could become metastatic by the time they're 80 or 85. And we've just basically cut them off of maybe another 10 years of life.
Got it. No, I think that's really, really good advice. And so along that same vein, testicular cancer is something we talk about a lot too. And this tends to often affect younger men who rarely see doctors. And what are some key signs or habits men should know to really catch these problems early?
Yeah. You could circle back to what we were talking about in the beginning of, we need to be better at convincing men, especially young men, to go to the doctor regularly. Because I think there's a little bit of embarrassment or maybe a little bit of pride that goes into that. Like, oh, like me in college, I look good, I felt great. Oh, I'll just go to urgent care. I don't need to follow up the primary care doctor. The other side is actually on the physician. So maybe once or twice in my entire life have I ever gotten a physical exam where somebody was like, actually, got down there and actually felt around. And like, that's not a thing anymore like it used to be, because we've cultivated a society where maybe that for some reason feels inappropriate, even though it's a doctor-patient relationship. And I think we really need to bring that back, because we see so many young people diagnosed with testicular cancer, disproportionately young versus old people. And it's because they barely see doctors. They don't really go that much. And the good news about it is that in early stage, it is very treatable, but only if it's caught early. You hear of these horror stories where, somebody felt a painless lump in their testicle and they didn't get it checked out for a year or so, and then it became metastatic, and obviously bad things happen. So the key things that I would point out for guys is, what do you look for? You want to look for typically a painless lump or a firm area on one of the testicles. So, when you're in the shower every now and then, just like have a feel around down there, like know what it's supposed to feel like, and then track that over time. So like, 3 years, if you're like, I don't think it was like that before, then you can actually act on it. Because if you're not consciously doing that before, then you're like, maybe it's always been there. And that's the problem. Feeling of heaviness in one testicle over another, or changing in size, a dull ache, could be in the groin, testicle, lower abdomen. That doesn't really match up with like a muscle strain. I would do self-checks monthly in the shower. I wouldn't wait out of embarrassment, because it's something that we all have to deal with. So it's 50% of the population, the 49% of the population that has to deal with this. So it's nothing that is one person over another. It's super embarrassing to actually have to monitor. So it's a atmosphere that we need to cultivate of being more normal. Because I think as men, we just don't like to talk about problems, especially things like that. And so just creating awareness about it, which Movember is great. And I'm actually kind of pissed because I had a beard 3 days ago and I totally forgot to shave it into a mustache. So I should have kept it for the interview.
That's all right. I like what you got going on there. We'll keep going. So let's pivot a little bit to supplements, right? So, I mean, we talked about testosterone. The men's supplement space is crowded crowded with products talking about testosterone support and boost your testosterone or vitality.
Yeah.
What ingredients do you think have real evidence behind them, and which are mostly marketing?
I think I would say most test booster, especially the blends, are more marketing than they are medicine. So the claims are actually way bigger than the effect size. And I think that causes a problem, because you get a lot of people that are going to GMC or they're GNC, and they're getting they're getting things that aren't third party tested. They don't really know what's in there because of proprietary blends. And I think that can be dangerous. So if we boil it down to the basics, the things that actually have like some evidence in it, vitamin D is great. Like it's helpful, especially if you're deficient, which a lot of us are, or at least insufficient in vitamin D. And it does have moderate impact on testosterone and overall health. And we know that it's a hormone and it's involved in that whole cascade. So that's one of my most important ones that I think pretty much everybody should at least see what their levels are, if not supplement with. Magnesium and zinc are really important too. And like I said, these are just the basics. They're important cofactors in over 300, maybe over 1,000 processes in the body. If you correct a deficiency, it can improve testosterone and energy, but also mega dosing past normal levels doesn't make you like a superhuman. So always good to get your levels checked. Some other ones that I could think of: creatine monohydrate. It's not a testosterone booster, but it's one of the most proven compounds for like strength, muscle health, possibly brain health. Ashwagandha is great because some data shows that it can actually lower perceived stress. And when we get out of whack cortisol rhythms, it can really mess up our hormone cascade. So if you deal with stress, primarily with lifestyle interventions, but if you use supplements, something like ashwagandha can really help bring that perceived stress down and possibly bring back that testosterone level if that's the reason why it's low. And then the other one that I've heard a lot about, and I've personally kind of dabbled with, is Tongkat Ali. It has mixed data, but some small trials actually do show modest increases in testosterone and libido. And I've actually tested myself, and I saw about a 150 to 200 increase in testosterone just after a few months of using that. So that's definitely one. Obviously, talk to your physician first before doing any of this. These are all just general thoughts and ideas of mine, but everybody's different and individualized. So I wouldn't take my word for it. Go and talk to your doctor about it. But those are the ones that I've actually seen data on. But as far as these proprietary blends with tiny doses of 15 different herbs, I don't think you're going to get much out of that other than just breaking the bank.
Got it. I'd say Tongkat Ali. I love a deep cut when it comes to the supplement space. That's a good one. That one doesn't come up very often, but it's one that I like the data behind it. I agree with you, pretty early, but hopefully some of our scientific labs will do a little more work on that coming up.
Yeah, man.
So as we're running up against like the end here, I really want to focus on the mental health connection when it comes to men's health. Mental health is a very difficult topic for many men to discuss. It's stigmatized. It's not something that we've traditionally been okay talking about. How do you encourage your patients to open up about emotional or psychological struggles?
Yeah, a lot of men don't respond to the question, how's your mental health, or how you holding up, or we don't like to talk about our feelings traditionally. So you have to approach men in a different way in order to kind of get down to the nitty gritty. The first thing is just to normalize it right away and just say like, hey, look, almost every guy that I work with is dealing with some sort of combination with stress, anxiety, or burnout. And I can see, or I care about how this is affecting you. So let me ask you a couple of questions. So, and I think that's a great way for a physician to approach it, because you kind of put them in the boat with everybody else. It's not like we're singling you out. Let's see if you have a problem. It's no, everybody's kind of dealing with something. So let's see, let's kind of look under the hood here. And then asking concrete, non-threatening questions and very direct, specific ones. So like, how is your sleep? Not how are you doing? How's your sleep? Are you having any trouble turning your brain off at night? Have you lost interest in things that you usually care about? How's your patience with your kids or your partner lately? Tie it to goals that they really care about too. So like, if your sleep and stress stay like this, is this going to impact your work? It also could impact your muscle mass and the ability to actually work out and gain muscle, your libido, your longevity. So let's get ahead of that. So when you put it in kind of this way where it's a cat and mouse game of like trying to chase a goal, then it takes away from the touchy-feeliness of it. And I think that's important for, at least for me, and I feel like for most men. If you can put it in that way, it doesn't feel threatening at all, and it opens up people a little bit to start talking about it, which I think is the number one thing that we need to do.
Got it. I love that. And I like the reframing of that. You know, we personally, I know it's also hard for me to open up on those things. So, as you were saying those questions, I'm thinking like, oh, I would be okay answering that. I'd be okay answering that. And I think that's a good perspective to lay over it. Okay. I want to rapid fire some up here. I'm going to ask you a few quick questions. You know, you can give me the quick answer and then we'll wrap everything up. So,
Okay.
question one supplement every man should consider.
Creatine monohydrate, 5
Okay.
to 10, maybe even 15 grams. Supports strength, muscle health, power output, and now we are seeing a lot of cognitive benefits from that too.
Awesome. One test number or biomarker every man over 30 should know.
I love vitamin D, but I'm going to go with ApoB on this just because if you want to quantify the total number of atherogenic particles that are driving plaque formation for cardiovascular health, rather than just your typical cholesterol panel, ApoB is really important for that. And I think it's really great at just determining just total long-term cardiovascular risk.
Awesome. One health habit men underestimate but could make the biggest difference.
Lifting weights consistently for decades, for
Okay.
sure. Yeah.
Awesome. And then one resource or mindset that has most influenced how you approach men's health.
My personal mindset is I'm not here to barely stay out of the hospital. I'm here to be stronger, sharper, and more resilient. At least try to be stronger, sharper, more resilient at that 50 than I am at 28.
Awesome. Dr. Clay Moss, this has been fantastic. Thank you so much for joining SuppCo Science Corner. We really appreciate it.
Jordan, you're the man. Thank you, dude.